Now, from CBS 4 News, this is Facing South Florida with Jim DeFede.
Good morning, I'm Jim DeFede and welcome to Facing South Florida. A pandemic of the unvaccinated. That is what the latest surge in COVID cases is being called, as South Florida hospitals are seeing a dramatic rise in ICU patients with COVID. Nearly 95% of those fighting for their lives in the ICU are there because they made the decision not to get vaccinated. Unlike what we saw in 2020, this latest round includes people who are younger and otherwise healthier. Grace Meatley is an ICU nurse at Jackson. She recalls how a woman in her early 20s recently died.
It was very emotional for the staff to see such a young person lose their life from COVID, and that person, of course, was not vaccinated.
In another instance, 3 members of the same family came in together. Within days, 2 of them were dead.
To be the person who survived that, and especially knowing that the vaccine was available, and as a family, you chose not to get the vaccine. So it's just something that, that family member, unfortunately, has to live with.
You'll hear more from Grace and some of the other nurses on the front lines in a few minutes. But first, I wanted to share part of a conversation I had with Dr. Eileen Marty, an infectious disease expert at FIU.
We're on another huge upswing. The bulk of the cases that are presenting are between our people that are children of the ages of 12 all the way to people about 49. That's where the bulk of the cases are. We're seeing a lot of people in their 20s, and they're very sick. And so what we're dealing with is essentially a much more aggressive virus than what we were dealing with before, and that was bad enough. So what we have now is a virus that is contagious at lower dose, that the people who get infected, particularly the unvaccinated people, are shedding outrageous amounts of virus into the environment and into each other. And that's one of the main reasons that cases are rising. But it's also rising because so many people thought this was over and thought they could go back to business as usual. And the reality is the pandemic is still raging throughout the world, and very much so here in the United States.
When we talk about hospitalizations and those who get seriously ill, do you agree with the notion that this is an epidemic among the unvaccinated? That primarily, overwhelmingly, this is the unvaccinated are the ones getting into the hospital?
Yeah, upwards of 95 to 99% of the people who need hospitalizations are individuals who are unvaccinated.
I know that you've been talking to folks around not only the country, but around the world, just sort of compare notes. What are you seeing in your hospitals? What are you seeing in your countries? What are you hearing from other places? And does it mirror what's happening here in South Florida?
Very much so. Throughout the United States, I see anguish among physicians and other caretakers by the rising numbers and by the youth of the people who we're having to hospitalize. That's probably the most alarming, is we're really starting to see a lot more disease in children, that are in the age where they could be vaccinated and haven't been vaccinated in particular, and of course in those 20-year-olds. That's been a great part of our conversations. What can we do to help these individuals, because we really need to get to them before they get infected and get them protected.
And that's because this Delta variant is so much more aggressive than the original SARS virus, where you saw a lot of young people saying, well, this is really a disease that will only take your life if you have an underlying condition, if you're elderly, but if you're young and healthy, chances are you're not going to get really sick from the original version of COVID that we saw. That's not true anymore with this variant. Is that true?
It's not. It's you're still better off if you're young. That's still true, but nonetheless, there's also the something that was also a fallacy to think that just because you didn't manifest much illness, you're off the hook completely. That's just not true. Many of the individuals who had no COVID symptoms a few months down the road are showing up with post-COVID problems, including myocarditis in some of the young athletes, which is just tragic.
What is different about the variant than the original, and why does it scare you more?
It's really far more effective than last year's version of the SARS-2 virus. So you need a much lower much lower dose in order to get infected, in order to get sick. As long as there are a lot of people who are unvaccinated and easy for this virus to get into, the more it has an opportunity to mutate into an even more aggressive form.
If you look at the numbers, Miami-Dade County is doing well when it comes to getting people to take the vaccine. Approximately 75% of the county is already vaccinated. In Broward, that number is about 68%. Ironically, one place where the vaccination rate is not doing well? Jackson Health System. Of the 13,000 employees, only 58% are vaccinated. That includes all employees. Now, among doctors, more than 95% are vaccinated. But for nurses, it's about 67%, which means 1 out of every 3 nurses is not vaccinated. I asked Jackson CEO Carlos Magoya about those statistics. When you're handed those numbers and realize that within the health system, only 58% are vaccinated, are you a little embarrassed by that number, given that what you do for a living?
Am I embarrassed? Probably. I would tell you that's an industry-wide issue. This is not just a Jackson issue. Our people are no different than the people in the streets. We're human beings. We're susceptible to rumors. In the healthcare industry, we listen to rumors 10 times as much as you do out in the streets. So these people are believing some of those rumors that make no sense whatsoever. And frankly, all we can do is the same thing I'm trying to do out in the community, to educate our people to understand it. And I'm not giving up the fight. I get frustrated because I can talk to what I consider to be smart people that are reasonable and are not and understand the science, and they just don't get it. But we got to keep fighting and educating as many people as possible to make sure they understand the value and the importance of getting vaccinated.
Well, why not move beyond frustration? Why not move to mandating it? If you want to work at Jackson Health System, you must be vaccinated.
There's something minor called civil rights, and I'm not one that likes to strong arm people to do something. I really believe that people have a choice to do that, and I want to make sure that people do it for the right reason. I do not like the idea of mandating it. We could end up there one day. We actually discussed that we have our every Wednesday afternoon, we have a 4 o'clock call with all the hospitals in South Florida. We did discuss the possibility of mandating it from an industry-wide standpoint in South Florida. But frankly, we got to get people to do it for the right reason. And the right reason is, if you're in the healthcare business, you not only got to take care of other people, you got to take care of yourself for taking care of other people. You need to understand the value of getting vaccinated. And that's what I'm trying to get to.
There is also increasing criticism on Governor Ron DeSantis. Now, the governor made the right call when he locked down nursing homes at the start of the pandemic, and he provided resources in those early days to local cities and counties. But he has also undermined efforts by local communities to keep their people safe and regularly mocked masks. Like his role model Donald Trump, he has taken the vaccine, but he didn't release any pictures of him actually getting the shot. And like many Republicans, he goes out of his way to vilify Dr. Anthony Fauci.
There's been talk about potentially people advocating at the federal level imposing compulsory masks on kids. We're not doing that in Florida, okay? We need our kids to breathe. I have a 3-year-old son. You got people like Fauci saying he should be muzzled, that you should be throwing masks on these 3-year-old kids. It's totally unacceptable.
He has even gone so far as to fundraise off his disdain for science by selling on his campaign website "Don't Fauci My Florida" t-shirts and beer cozies that read, "How the hell am I supposed to drink a beer with a mask on?" This week, the Committee to Protect Healthcare, a group of doctors from across Florida, lambasted the governor for not doing more as we see cases once again rising.
If DeSantis was concerned about stopping COVID-19 spread, as he was about coming up with these clever jabs at Dr. Fauci, we might not be in this position.
Why is he making fun of Fauci, one of the most esteemed scientists and infectious disease specialists in the world, and a man who I admire? Why is he undermining infectious disease experts and their recommendations? The consequences of leadership has been a steep rise in COVID-19 cases and increased numbers of Floridians dying.
But at the same time as DeSantis says the vaccines are effective, which they are, he's also banning businesses from requiring proof of vaccination. He's taken away private companies' abilities to protect their employees and customers by requiring the safe and readily available vaccine. Governor DeSantis also sued the CDC in an attempt to prevent them from enforcing rules on cruise ships in Florida.
After months and months of losing patients, friends, and family members, nearly 40,000 Floridians in total so far, it's beyond discouraging to see DeSantis celebrating. As a physician and Floridian, I am frankly angry and ashamed.
This war against COVID is not over, and when we come back, we will hear more from the nurses on the front lines. Stay with us.